Good morning, everyone. Did you know that obsessive compulsive disorder, also known as OCD, has been around since 1868? According to an article, A History of OCD, that was published in 2013, William Gressnefer was a theologist who would diagnose scrupulosity issues. Scrupulosity was the term used for OCD before OCD itself was coined. OCD is a mental disorder that can disrupt a sufferer's daily life as well as those around them. Today I will discuss the history and types, the symptoms and diagnosis, and finally the treatment. At the end of this speech, you will understand why OCD requires more studies to find an effective treatment. OCD is a difficult disorder to recognize. It is defined as a mental disorder of someone who suffers from intrusive, recurring, or impulsive thoughts that requires them to complete certain actions. These actions are called rituals. And rituals must be done because the individual believes that it will stop the intrusive thoughts or the anxiety. If the rituals are not completed, then anxiety will set in. The thought process is considered the obsession aspect, while the behavior is considered the compulsive aspect. Studies conducted by Gorodino et al. In 2017 show the average onset of OCD is 19 years old and is more prevalent in women than men. Adams et al. From 2017 states OCD has a genetic component, but environmental components play a large role in the cause of the disorder as well. An individual may have a biological predisposition for the disorder if a family member has it. The symptoms also may lie dormant until a stressful situation arises, which can trigger the OCD and the obsessive-compulsive thoughts. According to Kiani, Aini, and Rashida in 2018, the relationship between a parent and a child may also be a cause. If the parents have a strict behavior policy with very little leniency, then the child is also at a higher risk of developing OCD. A history from OCD from 2013 states that there are 5 different types of OCD. There's checking, where an individual consistently checks and rechecks that something has been done. Contamination and mental contamination, or a feeling that the individual is unclean. Symmetry and ordering, ruminations or intrusive thoughts, and hoarding. The manifestation of the type depends on the etiology of the disorder itself and how the individual perceived the situation and or biologically responded to the events. Symptoms of OCD may vary from person to person based on severity. Overall, a person may seem confused, frantic, anxiety-ridden, and determined to get a specific task done when in the middle of an episode. There are separate symptoms for the obsessive aspect and the compulsive aspect. Common obsessive symptoms are the individual may be in the presence of intrusive thoughts and have a difficulty to stop thinking about these thoughts. Physical and compulsive symptoms have a vast range, but are generally visible through witnessing rituals or repeated actions out of the ordinary. Other noticeable behavior symptoms come in forms of triggers, avoidance, and reassurance, which is forcefully asking individuals if the fear is their reality or if they're just making it up. Oftentimes, multiple symptoms can overlap because multiple types of the disorder are present. The only official way to know if these symptoms are part of the disorder is to be diagnosed. And unable to be diagnosed, you must go seek help from your professional medical health care provider or go see your family doctor. They'll run various blood tests and they'll ask you questionnaires. And if they feel that you have a mental disorder, they will refer you to a therapist. The therapist will then conduct a questionnaire themselves, and they have to follow what is called the NICE guidelines. At first, they will make sure that you have obsessions and or compulsions because only one is needed to be diagnosed with the disorder. And the other factor that they look for is that this disorder must disrupt your daily life, whether it comes school, work, social interactions, or taking care of yourself. The obsessive compulsive must be present for 1 hour out of a 24-hour period. And once all of these are established, they'll use the NICE guidelines, which is a 4-item list that they base their questions off of. These guidelines are: the thoughts must be recognized by the patient as their own. One thought or act must be unable to resist successfully, and the thought or the act must be unpleasant to the individual. The thoughts, impulses, and images are unpleasant and repetitive. Important to diagnosing is ruling out comorbidities, and comorbidities with OCD are skin picking disorder, hoarding disorder, dysmorphic body disorder, seasonal affective disorder, depression, OCPD, anxiety, and emetophobia. The difference between OCD and OCPD is that OCD sees these thoughts and intrusive behaviors as unpleasant or distasteful, while OCPD sees it as necessary or means to an end, so it's not necessarily unpleasant for them. Once examined and diagnosed, usually both the doctor and the therapist will work together to find an effective treatment. There are no known cures for OCD. Treatment consists of different types of therapy, prescriptions, and lifestyle changes. The most effective treatment is cognitive behavioral therapy, or CBT, which is where the client will go and speak to a therapist on multiple different occasions over a short period of time. Sometimes therapy sessions can last from a year to 2 years. They will discuss where the trigger comes from on the OCD and what the initial cause is, and the therapist will guide them in ways of lifestyle changes and give them advice on how to stop the behaviors. That way they can live close to a normal life, or as close to a normal life as they possibly can with this disorder. According to a study done by Daugherty et al. In 2018, brain stimulation is also an effective treatment. This treatment targets parts of the brain with electromagnetic pulses to reroute certain neural functions in the brain. The goal is to intervene in the CTSC loop in the brain, which connects the cerebral cortex to the basal ganglia. This treatment was proven to be effective, but it's not as effective as it should be, so it's not considered a good treatment for every single case. It's kind of a here or there. It's also very expensive. Other effective treatments are considered experimental at this time due to the fact that the studies cannot replicate consistent results of the tests. And even though OCD is easy to diagnose, the etiology is not well known, and the way to successfully treat a mental disorder is to know the etiology of the disorder itself. In conclusion, OCD is a mental disorder that disrupts the sufferer's daily life and those around them, which is proven by the long history with the 5 different types, the diagnosis that can be achieved through its symptoms, and the expensive but effective treatments. You should now understand why more studies are needed You should now understand why more research and studies are needed on OCD so we can find an effective treatment for the disease. Thank you for your time. Hope everybody has a fabulous day.